Well, I was looking for more spending for mental health last night, and what I found was $361 million. That's in new money that will be used to establish a free digital support program for 150,000 Australians. Money will also go towards more nurses, social workers and counsellors to meet demand, but the problems go much deeper than that. Joining me live is Psychiatrist Professor Patrick McGorry. Patrick, thanks so much for your time and
Thank
great
you,
to
Laura.
see you in person as well.
Thank you.
Look, they weren't cutting funding for mental health, but it's disappointing that they haven't met the demand of the times, I think. There's no recognition here that this government gets what a problem needs to be solved in the mental health space.
Well, I think Mark Butler, the Minister for Health, does actually get it. Have had very positive discussions with him around the blueprint that we need. So if you're going to put more money in, it has to be into evidence-based programs that actually work and improve outcomes for the 5 million Australians with mental illness. And
5 million?
5 million every year, and probably many more over the whole course of the life. Maybe half of us at some point will have problems. And it's typically coming on in young people, of course, and we've seen a 50% rise in the prevalence of mental illness in young people over the last 15 years, such that 2 out of 5 young people now need help. And so you're right, there needs to be a much stronger response, probably at least double, the investment that we're seeing now. But to get there, we need the right models of care. And so I was encouraged last night because what's supported is the Commonwealth getting stronger into this moderate to severe space, which we call the missing middle. And state governments are never going to meet the need there. So it has to be the Commonwealth getting into that space to back up headspace and back up primary care. And they actually are showing a commitment to that, but it's slow. We need these processes to deliver quickly because we do have the knowledge and expertise to meet that need. And we just need to sort of put it on the ground and in a stepwise way. We can't do it overnight. I would say over a number of years we could build that system. We've got the capacity, and Australia's always been the innovator and always been the creator in new models of care. So we can do this, but it's got to be a higher priority for the government. In the lead up to the election, I think we need to see this committed to before the election, not just an election promise. It needs to be done as soon as it possibly can be. And I think Mark Butler is an advocate for that, and I think the opposition are supportive of this too. So I'm really hoping that we will get somewhere in the next few months.
Okay, you're less cynical than I. And look, not everything comes down to money. It also comes down to systems and the way community organisations speak to state governments and state governments working with the federal government, because this is a whole of government and society approach. But is it unwieldy at the moment? And how much would you say the sector's underfunded by?
Yeah, look, it's definitely unwieldy. And I think the model where you have competitive tendering delivered by PHNs fragments the precious dollars we already have. So it's diffused into lots of different agencies, which then are sort of inefficiently work with each other. We need to streamline this and centralise things much more. So that's a very fair point.
Things have worked, haven't they? Like Headspace.
Headspace is effective and cost effective, but it's struggling. We've lost 50% of our workforce because of the financial model being obsolete at a time when the need has never been greater, and Headspace needs this backup system for the more complex cases. So I think the Minister understands all this very well, and these processes are designed to address it, but there is an urgency. So coming back to your cynicism, I mean, I think we've been very patient in the mental health field, and the public have been very patient. The public there's a simmering level of deep distress across the whole society in relation to mental health. We've discussed this many times. It's just sitting there waiting to be responded to. And any government that actually does that in a decisive and top priority way, like they did with the NDIS 10 years ago, I hope it doesn't end up in the same space. That we have to do things much more carefully, I think, in mental health. But we've got to actually do it. And it's a much bigger priority than almost anything else in health at the moment, especially in relation to young people.